So this is a case of appendectomy. This patient is 33-year-old male who had got appendicitis 2 months back. So he was managed medically, he refused surgery, and now he has come back with repeated abdominal pain and acute appendicitis again, second attack of acute appendicitis. And you can see that here, if you see the appendix is swollen, it's about to get perforated. Okay, so today we are doing it as an emergency. It came with severe abdominal pain. So appendicitis, always go for surgery, don't wait. So if you wait, you will get complications. Even if you treat with antibiotics, you are going to get recurrent appendicitis like this. So surgery is here very difficult. You can see the appendix is so much swollen, it's stuck to the intestines. You can see the small intestine is stuck to the appendix, the planes are not clear. You can here again see large intestine, this is the left side large intestine is stuck here. So surgery can be difficult sometimes. So also complicated. So always acute appendicitis, go for surgery, don't wait. So simple treatment of appendix is laparoscopic surgery. You can see now so small wounds. So don't wait for surgery, don't go for medical management. Always surgery is the best treatment for acute appendicitis. So even if you treat with antibiotics, it's going to come back. So it's not going to go like that. So always go for laparoscopic appendicectomy. Simple treatment, 1 day admission, next day discharge. Okay, no complications, you will save a lot of money also. Okay. So now we have released the appendix completely. So you can see this is the appendix, the entire thing right from here till here is the appendix. So long and so much infected, and you can see the intestine, the small intestine, the large intestine, everything stuck here. Okay. So always appendicitis, go for surgery. Simple treatment. Don't wait with antibiotics and all. Okay. Very rarely, very few situations we treat with antibiotics. So appendix is going to, once you get infection, it's going to come back again and again. Okay. So simple treatment. And you can see here the large intestine. This is a left side colon. This is a sigmoid colon which is stuck here because of the previous infection. Especially in women, women of childbearing age group, appendicitis, if it gets complicated, it will create a lot of problems. So that will in the the ovaries, the fallopian tubes will get stuck, and a very high chance of developing ectopic pregnancy. So if you have a complicated appendicitis, that will cause adhesions to the tubes, ovaries and all, then you may get ectopic pregnancy also. So always avoid treating appendicitis with medicines. There are very few situations where you give antibiotics, very early appendicitis which responds well to antibiotics, and very late, say mass, abscess and all, where abscess is treated differently. If there is a mass, inflammatory mass, or the patient is not fit, then you give antibiotics. Otherwise appendicitis, always better to go for surgery. It's a very simple surgery. Thank you so much.